In November 2020, Laing O'Rourke handed over the Grange University Hospital in South Wales to the Aneurin Bevan University Health Board. This milestone came 4 months ahead of original schedule, on budget and with 0 defects, all achieved amid the restrictions and complications of the COVID-19 pandemic. And as evidence of the strength of the delivery partnership to meet the needs of the Health Board, clinical ward space was even handed over in April 2020, a year early, as reserve capacity for coronavirus patients. The £350 million, 560-bed critical care hospital provides specialist treatment for the region's most seriously ill patients and is the emergency department for 600,000 people in Gwent. It is a key component of the Health Board's Clinical Futures programme, which is transforming health service delivery in this part of Wales. Construction created work for more than 10,000 people, 38% of them local and 117 of whom were previously unemployed. The on-site workforce averaged 350 and peaked at 650 people, including 39 apprentices. From before contracts were signed in October 2017, the focus of the Health Board, Laing O'Rourke and other partners was on the design of the hospital. Finalising the design early was vital for 2 reasons. To enable the deployment of Laing O'Rourke's pioneering, modern methods of construction to improve schedule, productivity, safety and quality, and to create clinical areas that allowed the medical staff to provide the highest standards of patient care. The Laing O'Rourke team drew on the power of its experience from delivering other state-of-the-art hospitals, including Dumfries and Galloway Royal Infirmary, Alderhay Children's Hospital and Liverpool's Clatterbridge Cancer Centre to optimise design. Importantly, this process was informed in detail by patient groups and the doctors and nurses whose skill and care would transform the Grange from state-of-the-art facility into a building in which lives are saved.
This is a really modern facility. It's much more spacious. So we've got access to top-level care and the facilities really are incredible. Everything is brand new. The space to work in is light. We have windows, which we didn't really have at the Royal Gwent site. So those little things just make a huge difference. And clinicians have been involved in this from the very start. So we've been able to design what we know works and leave out what we know doesn't work.
In the new emergency ward, the priority is to ensure the rapid movement of the most seriously ill patients to resuscitation bays and those less badly injured to one of the department's 57 consult and exam cubicles. In the wards, the design maximised the number of single bedrooms to help limit the spread of hospital-acquired infections. Each room incorporates bed-head wall-on suites to improve patient amenity and reduce the risk of falls, and to create a distinct clinical zone in the event of resuscitation being required. The 32-bed wards can flex depending on patient demand across clinical departments. In all the wards, across all departments, dispersed staff bases mean nursing staff are never more than 25 metres from a patient, which reduces the distance they travel during shifts and helps reduce tiredness and fatigue. By standardising the design of rooms and wards throughout the hospital, including the location of equipment, staff are immediately familiar with the facilities wherever they are caring for a patient. The hospital also has areas providing specialist care and home to complex equipment, including 11 state-of-the-art operating theatres, 2 maternity theatres, a highly specialist neonatal ICU, CAT and MRI suites, and a pathology lab, all of which supports better health outcomes for patients.
The benefit it's going to bring is absolutely huge, and I think we're going to see much better patient outcomes and a much better patient experience with access to amazing resources in a fantastic building. It's really hard to describe just how much this is going to benefit patients.
The Grange University Hospital has also been designed to be a warm and welcoming environment for patients of all ages and their families. The building's design contains just 3 zones: the entrance zone with double height spaces, the care zone with high-quality accommodation, standardised for consistency, durability and serviceability, and the diagnostics and treatment zone containing highly technical and bespoke facilities. This makes it easy to navigate for staff and visitors alike. The result of this careful and considered design is a modern, precise, bespoke where required, and highly technical building. At the heart of its construction are the needs of the dedicated medical professionals and the patients who rely on the Grange's care, comfort and amenity. The power of experience.